Hi, I'm Dr. Mitch Harlan, and welcome to the Truth Talks podcast. Today, I'm joined by an amazing guest, but before I introduce them to you, I want to ask that you please like and subscribe below. That way, we can continue to bring you these incredible stories. And if you're already liked and subscribed to our channel, we thank you for all of your support. Today's episode is with Dr. Richard Harris. Dr. Harris, how are you?
I'm doing great, Mitch. Thanks for having me on the show.
You are a pharmacist, you're a medical doctor, and you're a fitness guy. So you are the perfect guy to talk to. Now, I'm sure we're going to piss some people off. We're going to rub people the wrong way, but this is why we do podcasts, right? We're getting our information out there.
Absolutely. And I'm not afraid of anybody's comments. So you can at me, come at me, whatever. Let's do it.
We try and bring the most, best podcast we can possibly bring to our listeners, and hopefully you share with yours. And what we do is I pick and choose people according to whatever topic I want to do, and I want to always bring in that kind of expert opinion or expert advice or the best story I can find on a certain topic, and that's why you were chosen, my friend. I think it goes without saying you're a super smart guy, and what is interesting about that statement is when you kind of look at your pedigree that you have and watching some of the stuff you have on your podcast, which is Strive for Great Health Podcast. I want people to go check that out because you do everything. The last one was on thyroid. You have so much wellness on there. It is absolutely amazing. Congratulations for 20,000 downloads as well. But I want to jump right into this because I want to talk a little bit about the COVID, follow the science. So just briefly introduce yourself, tell us what all you're doing, and then let's jump into this podcast.
Yeah, absolutely. So, as you mentioned, I'm a pharmacist, I'm a physician, internal medicine trained. I do some PRN work in the hospital. So, I have been taking care of COVID patients since, November or October when we didn't really know what we were dealing with. Just people were sick with something. And then I also do integrative wellness. So, I have an online health and wellness practice. And like you said, the podcast, being a pharmacist and a physician, I have a unique perspective on medicine, and medications work at the macro level. They work at the population level. They may or may not work for you. And like you said earlier, you are the gateway for your own wellness. And so, what I do now, and what I'm really passionate about, is teaching people to take control of their health so that they can make decisions about their health from a place of power.
Which is amazing because that's exactly what your podcast does. And one of the things I always kind of talk about when it comes to science is one of the definitions is the intellectual and practical activity encompassing the systematic study of the structure and behavior of the physical and natural world through observation and experiment. That is a really fun topic because there's so much stuff around follow the science. We have Fauci's. We had Del Bigtree on our show talking about vaccinations, and there's just so many opinions, and now it seems to have gone really political. Do you have any opinion on that? Because I say medicine should never collide with politics.
It really shouldn't, but of course it has. I work in big healthcare systems and there's tons of politics involved. If it was just about medicine, there wouldn't be a protocol that could override what I think as a medical doctor. But there's so many times in the hospital where I'm told you can't do that. And well, who says that? This person who's making this decision is not at the bedside seeing this individual person. And you've been in practice a long time. There's a lot of nuance. There's a lot of things that, laboratory data doesn't tell you everything. Vitals don't tell you everything. There's something that is important about laying hands on someone and seeing them face to face.
That's the gospel. It really is. And one of the things that I really want to hit on today that I think you are the absolute expert in. We talk about COVID, we talk about this virus, but what we never talk about is the host, right? What is it that this virus is attacking to? It's the host, right? And so that is where everything comes into play. And that's why, again, in your pharmacy training, a person may get a Percocet, right? But that person may be 230 pounds, and then the 110-pound person's also getting the same Percocet. And the science would say this is going to help alleviate your pain, but there's a whole lot of variance between 220 and 110. And that's what I really want you to focus on with us today, if you would, because I know that you have every single background from the science of pharmacology to the science of being a practitioner to really the science of well being. So I want to just start, first of all, talk about the host. I want you to talk about COVID-19 and what might be different if the host was different.
This is a great subject because COVID-19 is doing something that we've never seen before in medicine. And I've been practicing some form for 16 years. I've never seen anything like this, to the extent that the course can be so widely variable between two different people. Now, you ask two different people what their symptoms are, how long they lasted, and you're going to hear two different things. Even from when I had it and my wife had it, our course was very different. And the other thing is that for people who have these comorbidities that we've all been hearing about, obesity, diabetes, or diabesity, as some people call it, metabolic syndrome, nutrient deficiencies, what this is doing is sending your body forward in time because of the amount of inflammation and the stress it causes. It's like aging your cells at the cellular level. And so you come out, years ahead in biological age. If I had to guess, and if someone did a study on this, you would see that there's a lot of biological aging. And so all what's this doing? That's all affecting the host tissue, the host pathology, your host organs. And like you mentioned, it really rubs me the wrong way that we've been in this mess for what, a year and a half now, and you've heard no famous doctor or TV doctor or health organization come out and say, "Hey, prioritize your metabolic health." Because we know if you even make subtle changes in your nutrition, your stress management, you can have profound impacts in your metabolic markers very quickly. You can turn some of that around very quickly. And if we had done that in the beginning, a lot of this mess would have been prevented.
I haven't heard one really come out and say any of that. I did see a post that you put out there that said 62% of people that were significantly hospitalized for COVID-19, it was all about the metabolics. And that's a really interesting statistic, and it's something that I really got fascinated with because there's so much conversation about hydroxychloroquine, the vaccination. No one talks about the host. And I want to remind everybody listening, the host we're talking about is you, the person. That is what the virus is attacking, is the patient or the person. We call it the host. So where do you think, or why do you think that isn't it? Is it money? Politics?
They're probably a combination of both, right? Politics follows money, money follows politics. And it's our sick care system. There's a big vested interest in keeping people sick. It's big business. Our sick care system is worth billions, if not trillions of dollars. What, do you spend $3.89 trillion on healthcare a year? It's 17% of our GDP, and that number is going up. So there is a big vested interest by big food, big pharma, keeping people sick. They don't make
Man,
money if people are healthy. They make money if people are sick. Now, that has to change because the stats are all heading in the wrong direction. By 2030, 50% of the country is going to be obese. I think so 12% of kids now have fatty liver disease, 20% of kids are obese. We're seeing people in their 20s and 30s have heart attacks, strokes, and on dialysis. Every single time I go in the hospital, I see a 30-year-old with a stroke, with a heart attack, on dialysis. These were diseases of old age. Now they're diseases of young people because they became metabolically unhealthy when they're 9, and now they're 29. They've had 20 years of being metabolically unhealthy. So that 29-year-old is really 75. And actually, that study that you mentioned earlier, the one that showed that 63% of COVID hospitalizations could be prevented if we are metabolically healthy, also showed that the risks for someone who's in their 30s who has obesity of severe COVID outcomes is the same as someone who's 75 with no medical conditions.
here I was thinking I was going to piss everybody off, but you just went ahead and took the reins on that one, baby. I like that a lot.
I have no problem speaking the truth, and it's not like I'm pulling this out of my butt. This is data. There's science behind this. There's epidemiological studies that are being done that shows this very clearly, that COVID really is a cardiometabolic disease. Because if we were cardiometabolically healthy, a lot of the disability, a lot of the damage, a lot of the hospitalizations could be prevented. 63% is an astronomically large number.
Especially when you're talking about science. I mean, that is astronomically high. I mean, that's just why I wanted to have this conversation, because I think it is the most important thing. In my profession, we've been preaching diet and exercise forever. I want to throw this out at you, and I want to get your opinion on this. We run another podcast early on, I think in season one, and it was a fitness group, online fitness group that we had done, named Hitch Fit, and it's all about diet and exercise. And my office manager, she dropped 50 some pounds. We've had numerous people in the practice do this, and a lot of them, see different primary care practitioners. And their numbers, they were coming back and like, oh my gosh, they were so happy. My cholesterol dropped so much. My triglycerides dropped so much. Only one doctor called me up and said, hey, what are you doing over there? And I told him, and he says, oh man, he says, I'm going to watch that podcast. Then he actually took interest, and he says, man, I think I'm going to get a lot of my patients doing this, right? It Have we become so numb to there's a pill for everything? Is that where we're at?
So you have to go back to medical school education. And medical school education teaches you to do two things: diagnose. Well, it teaches you the science behind diagnosis, because diagnosis is an art. It is an art form that you get better at as you practice. And then it teaches you about anatomy and then medications. So there is zero nutritional education, at least when I was in medical school. That's starting to change in some medical schools. I was never taught about meditation or stress management. I was never taught about the effects of going outside, light therapy, and how profound that can be. So some of these things that there's very good data behind, you're not taught about. It's all about medication. So when you go see a doctor, especially in our current system, they have on average about 7 minutes to spend with you. I can't go through an entire nutritional mindset coaching session in 7 minutes. So what do? They feel pressured to do something. And what's the something that's easiest to do and the something they know the most about? Medication. And so we go and fall on medication when really, for most people, like we mentioned, medication is not the answer. If it was the answer, we wouldn't have 65-year-olds on 16 medications. The average 65-year-olds on 12 to 16 medications. And a lot of those medications are for side effects of other medications or causing issues, or, it's a whole mess. So we have to get back to root cause and saying, okay, what is it that's causing this? It's our lifestyles. It's our lack of proper nutrition. Inputs determine outputs. If you put diesel engine into your gas car, what's going to happen? Bad things.
Bad things,
Bad things are
bad
going to
things.
happen. Breakdowns are going to happen. Your car's not going to function properly. If you're not putting the right nutrients in your body, what's going to happen? You're going to break down. It's going to manifest itself as some type of disease. If you're stressed out all the time, it's going to manifest itself as some type of disease. If you're not getting enough sleep, there's data that shows it's only 6% of Americans get enough sleep, eat nutritionally dense food, don't smoke, and don't drink to excess. Those four simple things, only 6% of Americans do.
You're preaching to the choir, man. I mean, I've seen it my whole practice career, right? And I think sometimes I'm a little bit different. I get a little bit more honest with my patients, I think, than a lot of people do. And you just got to try and say it in the right way, where it comes across, very sincere, and you're doing the right thing. But it's really hard for people to hear sometimes. I mean, they'll come in and they're morbidly obese, and like, why is my back still hurt, right? And sometimes you just got to kind of look them in the eye and say, you know what, here's the truth, and you may never come back to see me again, but I owe you the truth. And I think the truth doesn't really get exposed that much. Tell me how your colleagues, your other associates and stuff, how do they look at you?
Yeah, it's kind of funny. When I left the large practice I was at before I started this pathway I'm on now, they gave me such a hard time. They were, laughing at me, saying that stuff didn't matter, and all quote sign, all sorts of other stuff. And then my patients started to improve, started to get off medication. And then 6 months later, the same people were asking me, "Hey, what were you doing with this, and how did you set this up?" And so a lot of times, a lot of MDs will tell me, "Oh, that doesn't matter." And the person who's telling me that is overweight, is on medication, is stressed all the time, has poor behaviors. And so I'm saying, okay, if it doesn't matter, look at what's happening in your life, look at what's happening in my life, and look at what's happening with the people I'm helping. How many people are you getting off medications? How many people are you putting on medications? That's one of the things I always ask them. And, most of the time it's, well, I haven't really been able to get anybody off medications. How many people are you putting on medications? You see 25 people a day, you're probably putting 22, 23 of them writing medications for them. So there's a big fight in the holistic world, at least for me, what I've seen. And actually, I get along better with chiropractors than I do with MDs. Chiropractors are a lot more open to the line of wellness and holistic medicine and the benefits, and they see it all the time.
It is so true. So I have, let's see, two ER trained physicians in my office. One integrative health medicine medical doctor. We have an anesthesiologist, pain guy. And it's really kind of interesting because our environment is based around actually just getting people healthy. Like we do very little narcotics in the office. We do very little of that stuff. We're always trying to tell them, hey, this is how you get well. This is how you get sick. And what is interesting is I am noticing a huge shift though. I am seeing that the patient, which is the boss of all of us, right? They're starting to demand, wait a minute, I need to figure out something other than this. I think they're starting to see people get more sick. And I think that was kind of one of the things that COVID-19 brought to us is the fact that we're really unhealthy. We're extremely unhealthy.
Absolutely. And consumer dollars always speak. And you can start to see a lot of that is shifting, even in the products on the shelves. You see products all the time now, no preservatives, low sugar. The preferences are starting to go towards something is wrong in our lifestyles. If it's not our genetics, because our genetics haven't changed much since we were hunter gatherers, since the Stone Age times. All right, maybe 10% of our genome has updated to modern life. And what I always like to tell people is, look, you have to take responsibility for yourself, but it's not all your fault. I don't want to just blast people and say, this is all your fault. If you're obese, it's 100% your fault. It's not, because again, as we talked about, the system is designed to keep you that way. By the foods we eat, by the mantras in society, by marketing, everything that's you do as far as consumer products tells you, oh, just treat yourself. You deserve it. Take that time off. Don't be lazy. Why go to the gym? Your couch is so much better. There's Netflix and chill and all this other stuff. Everything that we're seeing on a daily basis is designed to keep us inactive and keep us eating. And so you have to overcome that. And that's why I do a lot of mindset coaching with my programs, because I realize it's not all of the individual's fault. There are some societal faults, there are some organizational faults. And so we have to make people aware of these and then shift their whole perspective into the fact that your body can heal itself if you put it in the right frame to do so.
This is why I wanted to have you on the show because I hope a lot of our listeners and just people that we pick up really start looking into all the stuff that you're doing because it becomes really interesting in this perspective. When I started this program, Hitch Fit as well, right? It's all about a workout plan. It's all about the diet and eating at the right time. Number one, you get tired of eating. It's more food than what you would think. Number two, it really opens your eyes to all the shit that you've got in your pantry, right? The Funyuns, the Doritos, the donuts, the whatever. All that's gone with this program, right? But every single person who does it, they end up getting ripped and shredded and healthy, and all their numbers start to drop and decline. It's out there, but it's not out there. That's the thing that drives me crazy. Why isn't Dr. Harris on CNN and Fox News talking about how to get metabolically healthy to fight COVID-19? Obviously, I think the answer is probably political and money because there's not a lot of money in D3. There's not a lot of money in zinc, of which we know these things work. What's your insight on that?
Yeah, absolutely. It's a harder sell, right? In today's day and age, we're all about the get rich quick fix. What can I do to today to overcome this problem? I've had people come to me and say, "Well, I need this in 30 days." Like, it took your brain 25 years to develop. 25 years to develop. Your body doesn't work in cycle of days and weeks. Your body works in cycles of months and years. And look at professional bodybuilders, what they train for 5 to 7 years before they're even show ready,
Yeah.
before most of the time,
Yeah.
before they even do their first show. So they put in years of work before they even get to the stage. So we have to change our association with our timelines. And then we have to make this a long-term goal for the long haul. And like you said, there's not a whole lot of money for corporations and organizations and things like that if you're long-term healthy, because you're taking care of yourself. Who am I really supporting? I'm supporting local farmers, right? The local farmers aren't really banding together and making a bunch of demands and making a bunch of marketing ploys and stuff like that. No, they're out there working the fields. They're working hard. So it's about who the money goes to when you're healthy, and it's going to go to back in your own pocket. It's going to go to your local economy, and it's going to go to some fitness centers, things like that. It's not these big corporations, and that's part of the problem.
Isn't that the truth, man? And that's the thing that I'm sitting there. You just described it perfectly, right? We do all this scientific testing on medications, obviously not to hurt people, right? We want the medicine to work for whatever illness that the person has. But there's like nothing done in the area of metabolic health, which is where all that wellness comes from. I mean, you can physically see the numbers drop in their blood work. You can physically see them becoming more active. The less your heart rate is lower, blood pressure lower, all this good stuff, but there's just no damn research or anybody that's willing to come on and talk about it. And that to me is really sad.
It is, and it's not a big money maker again for these corporations, so they're not going to go for it. But there are enough people out there like you and I who are really trying to make a difference that you can find the information, make your own plan, and be highly successful. Highly successful. You can formulate your own nutrient dense food plan. You can formulate your own mindset coaching, your own sleep habits, all of these things. There are trackers like Aura Rings and Fitbits where you can get all sorts of information about your sleep cycles, about your heart rate variability. I love tracking heart rate variability because it lets me know how my body's actually doing with my activities. If it really starts to drop, then I say, okay, I'm kind of stressed. Maybe I'm working too hard. Let me take it easy. If my heart rate variability is high, then I'm like, okay, my body is ready to go today. I'm gonna push it hard. I'm gonna work hard. I feel great. So let's go. I mean, there are so many different ways that you can become your own scientist. And it's funny because most people will put more research into buying a car than they will into their own body, which your body is a multi-million dollar piece of equipment, but you'll research a cell phone or something else way more than you would your own body.
It's a fact. I mean, just a fact, and it's crazy how we've allowed it to go there. But did we allow it to go there, or is that what we've been conditioned to believe? Because all the money is in the disease, not the cure, so to speak. It's one of those questions I think is kind of non-questioned anymore if you think about it. But when Dr. Harris hears follow the science, does that make you cringe?
No, absolutely not. It's funny because I read probably 5 clinical studies a week. And I have a folder of, I think, almost 600 clinical studies I've read in the last year and a half. And so everything that I talk about is data-based. It's not just something that is my opinion. One of the things that pisses me off, especially in this space, is never believe anyone who doesn't post data. I give people access to all of the data. You join my podcast group on Facebook, you have access to everything I have access to. This is no secret. I'm not hiding the information. I want the information to be freely shared. So you see a lot of times people post and it's their opinion. It's not science, it's not facts, it's their opinion. Oh, keto's dangerous, or oh, you have to be, low carb, or oh, fats are bad. Don't eat meat. No, eat only meat. And it's like, okay, there's a middle ground here, and there's some evidence for certain conditions and certain things like that. One thing may be better, but if you're following someone and they're not posting evidence and they're talking about this stuff, stop following them, because you don't know if you're getting science or if you're getting opinion.
Are you telling me that all these Facebook experts aren't really experts? Is that what you're trying to tell me?
I think they stayed at a Holiday Inn Express before posting on Facebook.
It's so true. But I think it's dangerous. I think there's a whole lot of danger in it. This rushed science and all this stuff is a concern of mine. Is that a concern of yours?
It is. It really is. There's been some good rush science that's come out of this, and there's been some bad. And science does take a little bit of interpretation, because how you frame the question matters. And so if you're unable to really analytically look at a clinical study, you could miss the point. Because there was one that came out recently with ivermectin, and it was outpatient ivermectin, and the patient population was very healthy. And so it decreased their time to recovery from 12 days to 10 days. And so if you look at it, you could say, oh, ivermectin doesn't work. But if you don't know that, hey, this is a generally healthy population, it's in a different country, this is not a representative sample of the population that's getting sick here in the US. So you have to understand the nuance and understand how they ask the question and why they ask the question to interpret the results. So now I saw articles coming out saying, oh, new study shows ivermectin doesn't work. Like, this is a patient population that we would expect to see minimal improvement in because of the dynamic of that population. So your conclusion saying it doesn't work is not valid. And it
R-
actually, what I think is interesting, and I just thought about this after we talked earlier, because the amount of inflammation that COVID causes, and how we mentioned that it's like sending your body forward in a time machine. 2 days earlier to symptom resolution may actually make a big impact, because that's 2 days of lower inflammation levels. And like we said, COVID causes really high levels of inflammation. I mean, the inflammation markers are sky high for people when they come into the hospital, or even sometimes as an outpatient. So 2 days may not seem like a lot, but that's 2 days where I have lowered the inflammation markers quicker because they're recovering quicker. And it'll be interesting to do like a retrospective study where you pool all of that, look at that, say, look at people, their levels, how fast they dropped, and then look at the long-term outcomes. Because we haven't even talked about the long haulers yet. These people were having symptoms 6 months later. 76% of hospitalized patients in one study had symptoms 1 month or 6 months later. 53% had fatigue, muscle weakness, anxiety, insomnia was common. One study showed that 44% had positive autoantibodies. We call ANA. These are antibodies to certain parts of the inside of cells, the nucleus. 19% had positive antibodies for the antibody that's associated with rheumatoid arthritis. So this is how much inflammation it's causing. So even 2 days of lowering that inflammation, I think could make a significant difference in the long term. Now, this is opinion. There's no data to back this up. I'm hoping maybe someone will do a study on this. I think the results could be fascinating.
Yeah, I wish somebody would do these studies, right? I mean, even tell me about this, because this is what me and my buddies we talk about all the time. But I'm getting older. I'm 51, and I'm like, you know what? I want to run an NMR, right? I want to see what my inflammation is. There's so much good data in that, because what if these COVID-19 people, what if they had decreased all of their blood inflammation prior to getting this COVID-19, right? I mean, there has to be some common sense where you would say, hey, listen, if you're eating a diet high in inflammation, your body's already at a high level of inflammation, and then you get this, common sense would tell you that's probably not a good thing, but we don't, no one talks about it.
Yeah, absolutely. So I have a podcast on this called Balancing the Immune System, because everyone thinks I need to boost my immune system. And this is a complicated subject. You don't need your immune system boosted all the time, because that leads to autoimmune disease where your body will start attacking itself. But you don't want your immune system underactive. You want it balanced. And this is a really cool concept. So things like vitamin D and vitamin C, we talk about those as being good for the immune system. Well, they serve dual roles with the immune system. Vitamin D actually helps our immune system activate to fight off infection, but it also pumps the brakes to keep it from going too far. Same thing with vitamin C. Vitamin C is absolutely necessary for our immune cells to make certain mediators that help regulate the other immune cells and activate them to fight off infection. But it's also an antioxidant to keep those immune cells from going too far and damaging too much of our host tissue. So we really need our immune system balanced and able to respond. And you're completely correct. We need to have these discussions. We need to talk about metabolic health because if you're obese, that's a pro inflammatory state. There's
Mhm.
no if, ands, or buts about that. The science on that is very clear. It shifts the population of your cells from cells that are anti-inflammatory. These are cells called macrophages. They're immune cells. If you have a higher amounts of body fat, you make more pro-inflammatory or inflammation causing macrophages.
And that's exactly why I wanted to bring you on our show because I've listened to a bunch of your stuff and it is so informative and it's dead on. And it's like, listen, if I can only do one at a time in the office, but on a podcast you can do one to many, right? So I want to drive everybody to it. And when we close out this segment, I want you to make sure that we get all the information so we can get all of our people listening to everything that you talk about because it is just again it's data driven, which I like. And research is usually good research. There's always that kind of questioning when it comes to politics and money and so on and so forth. And that's just part of I think the world that we live in today. But the other thing is it's not as overwhelming as people think.
Yeah, because everything that you see me do or hear me talk about is what I do in my life. I'm not asking anybody out there, my clients or things I talk about in the podcast. These are not things that I don't do. It's not like I'm saying do this and I'm sitting over there eating a bag of potato chips all the time. And it's small changes over time. I didn't come out of the womb like this. I have a plan. I enact that plan. Once I master something, then I move on to the next thing. And I just start incrementally adding new skills, just like we do with anything else in life. No one starts off as Beethoven. It takes a
Right.
lot of practice and a lot of time to eventually get there. And so that's the way you approach it. We all want to be great. We all want to feel good about ourselves, but we have to realize that it's a journey and it's one step after the next. And if you do it that way, 6 months, you'll wake up and be like, wow, I can't believe I've made all this progress. I can't believe who I am today. And I can't believe the impact that who I am today is having on those around me because the people around you will pick up the habits and the mindset that you have. And not only will you improve your life, you'll improve the lives of the people that you care about.
Ah, man, those are just beautiful words, and it's just blows me away that we've been working on this for this long, and we have probably the worst pandemic, obviously that hopefully that we'll ever see at this point. But how much of it could have been saved if people were just overall healthy? I think there's a real significant lack of real knowledge of how the body works and what nutrition and just eating clean, drinking clean, what it does. Not we always think of the heart because we've been pounded with the heart association, right? Just the heart. We don't think about the mind, the eyes, the reproductive area. We don't think about that, but all of it improves.
And it's all connected. There's so many intricacies that are happening in our body that you cannot think of a system isolated because it depends on so many other parts and the whole is greater than the individual parts. It really is. And you can start to see dramatic improvements in things that people didn't even think that were wrong with them once they start taking that holistic approach. And like you mentioned, it's criminal that most people know more about digging into the menu and figuring out what's wrong with their cell phones than their bodies
Yeah.
because there's a distinct lack of information. And you're right. Medical school teaches you about everything in silos. It doesn't teach you about the body as a whole. And that's one of the reasons why I went into internal medicine because I never wanted to lose the big picture. I never wanted to get lost in the weeds. And that's why one of the main goals of my podcast is to show people how interconnected it is. And even though your symptom might be something over here on the left, doing something on the right that you think won't help could actually be the solution that you need to help what's over here on the left.
Isn't it so true, man? And it seems rudimentary to us, but it's almost like it's this new concept that has come out, and I think there's just so many things. So while I've got you here, I mean, you were gracious enough to give us your time. Well, now I want to pick your brain on just some just kind of off the wall topics. All right, mask, no mask.
I think it's an individual choice. Masks are a risk mitigation technique. That's what they are, right? They're not an end all be all, solve all your problems. And a mask isn't going to do anything for you once you get COVID, right? So
Right.
you need a plan for that. And I think that it should be an individual choice. I am a fan of choice. Me personally, I'm going to continue to wear a mask. I'm around COVID people, and I would feel bad if I didn't, because I know that it is a risk mitigation technique. And I think people who are high risk should wear a mask. They should do everything they can to protect themselves, because this is a very serious infection if you have these comorbidities. I've seen people with obesity in their 30s stay in the hospital for over a month.
Yeah.
And what do they tell me? I wish I had worn a mask, and I wish I hadn't gone out. I wish I had taken this more seriously. None of them were like, I would do the same again.
Well, and I agree with you 100% on all that. Mask in a car by yourself.
I'm- Most of the time when that happens is because they forgot, right? I'm hoping, because I've definitely done that, where I've been driving around in the car and I have my mask on. People are looking at me funny, and I'm like, what is it, like bird poop on my car or something like that? And then I like go to scratch my face. I'm like, oh man, I left my mask on.
I want to believe that's true, but I'm not sure it is. I think there are some people that continue just to wear the mask in the car. I saw this meme that said, unless you stole the car, you can probably feel safe to take it off.
Yeah, it's true. It's same thing with masks outside, right? I mean, the
Right.
chance of transmission outside are extremely low. I wear a mask outside because I have horrible allergies and I'm walking my dog like 5 times a day, right? So it's actually helped me not feel terrible and sneeze all day here in Texas. We don't ever really not have pollen in the air.
Right. No, I mean, I think all these are really important because I see so many people arguing over this stuff all the time. And I'm sitting there thinking to myself, I'm like, is there any common sense any longer? Like, listen, you know what? I'm not a big fan of the mask, but listen, if you wear one and somebody's infected and they're coughing or sneezing around you and you're around a bunch of people, I can certainly see that it may help. And so, what's the big deal of just wearing it in that type of situation? But there's just so much politics and so much craziness on the internet any longer that it just drives me crazy.
Yeah, and we're such an all or nothing society, right? And that's not the case in these things. It's nuanced. So, people are like, well, someone wore a mask and got COVID. I'm like, yeah, okay. Again, it's a risk mitigation technique. It's not a fail safe. It's not infallible. But people get in accidents all the time and pass away, unfortunately, wearing their seatbelt. But all of us wear our seatbelt because we know it dramatically reduces our risk of something really bad happening to us. It's not 100%, but we know it's a very effective risk mitigation technique. And I think that's what people have to realize about these things. It's not all or none. Do what you can to protect yourself. Do what you think is best for you and your family, but also improve your cardiometabolic health, because that's the number one thing that's going to protect you and everyone else around you.
And that's exactly why I wanted to do this podcast with you, Dr. Harris. I wanted, not only are you incredibly brilliant, but you're also full of common sense. And that is just extremely exciting when I get to meet someone like that. It's like, oh my God, I can totally have a conversation with this guy and pretty much everything is going to make sense, right? I don't see that much anymore, especially on social media, and people are so worked up and they don't know what to do. But I wanted to get across today, because of all the work that you do, that metabolic health is probably the best answer we have for fighting this and anything else to come. Do you agree with that statement?
Absolutely. I mean, it's bigger than just this conversation, because if we continue down this path, look at all the lost hours of productivity, the billions it costs us because of diabetes, because of hypertension, because of obesity. We're losing hours and billions of dollars to these preventable diseases. In fact, the military says the number one problem they're having is finding recruits who are physically able to participate in the military. So this is a bigger conversation than COVID is drawing the spotlight to it. But this is a very concerning problem that our health as a collective society is crumbling. And it's going to get to a point where we are so unhealthy that we can't do anything. We can't defend ourselves. We can't take care of our families. We can't provide. We can't work. And we're starting to see this more and more and more. And, people are like, oh, this is just hyperbole. I'm like, it's not. We're heading towards that point. If the military is saying we're having problem finding healthy people, that's a big problem.
That's a big problem. And this is exactly where I want to segue this right now. Dr. Harris, tell us every way possible people can listen to your information.
Absolutely. So my podcast, the Strive for Great Health podcast, is on all major podcast platforms. I also post on my website. My company's called Great Health and Wellness. GHwellness.com is where you can find that. And I also will send out information when I'm doing speeches or webinars or things like that. And my YouTube channel has some more information as well.
And I want to encourage all of our listeners to go to your podcast. It is just incredible, incredible information. Everybody from beauty salons to restaurants to just your own communication with your family. Health is always one of the topics that comes up. And it seems overwhelming. Many people, I think, just get frustrated because they hear so much information from so many different platforms. But you're a pharmacist, you're a medical doctor, and you're also a fitness guy. And I believe that you are probably one of the greatest resources that we have when it comes to health. So I encourage all of our listeners and anybody that we pick up from this podcast, definitely come and listen to your stuff. And I appreciate you coming on our show. I can't even tell you how much I thank you.
Yeah, you're welcome, Mitch. Thanks for having me on the show. I really appreciate it. And thank you for all that you do as well to help people get healthy. And you're a really kind, caring, compassionate person, and you can tell that you have a burning desire to make this world a better place. So thank you.
Well, I appreciate that, and it's exactly what we're doing. I'm trying to figure it out. The best I can come up with now is we got to have a Kardashian or somebody sitting next to us, and we'll get that 1 million views. And I'm trying to figure all that out. But the moment that I do, we're going to share that with you, and we'll start getting 1 million views and getting people healthy and well.
Let's do it.
All right, brother. Thank you so much, man.
Thank you.
All right. Bye-bye.